Hi, and welcome to Florida Hospital's Health Chat. I'm Jennifer Roberts. Today I'm joined by Dr. Ashley Hill. He is an OBGYN with Lock Haven OBGYN here at Florida Hospital. Today we're going to talk a little bit about family planning. Dr. Hill, thank you so much for joining us. Tell me a little bit about what it means to preconception. What do parents, prospective parents, need to do to plan for a baby? Tell me a little bit about what they should be doing.
Jen, thanks for having me. I'm a big advocate of what we call preconceptual counseling. And it basically means that the future mom and her partner come in and sit down with us, and we go over all of her healthcare issues, any surgeries, prior pregnancies, prior complications, and we find a way to work with the mom and her partner to fine-tune their lifestyle so that when they get pregnant, hopefully things go swimmingly and there are no problems.
Yeah. What are some of the things that you advise mom and dads to do before they start trying to have a baby?
One of the most important piece of advice is to keep your weight in check. Or I guess a better way to put that would be keep your weight appropriate. And if it involves starting an exercise plan or seeing a nutritionist or just losing that last couple pounds, it's always a good idea before you get pregnant. We don't want you losing weight when you're pregnant. It's not very safe.
Right, right.
And the other would be to look at the medications you're on to see maybe some of these need to be tuned up a little bit or changed, because we want your healthcare problems to be optimally managed, but sometimes the medicines aren't safe during pregnancy. And those are two that I can think of.
Yeah.
And then the third would be to take vitamin with folic acid in it.
Great tips. Talk about, you work at Lock Haven OBGYN. You guys work with a team of doctors. You've got midwives on your team, you've got physicians on your team. Talk to me about why the team approach is, what are the advantages to that?
Well, thank you for the question. First, I have to give a shout out to our doctors. They're fantastic. I have handpicked these doctors and our midwives over the years, and I probably, on average, look at 20 to 25 resumes before I even start interviewing. So these are really, really a fine, I'm very proud of our group of doctors, just very proud. The team approach is great because every doctor and every midwife in our practice brings a little something different to the table and educates the patient and her family to the point where at the end of the pregnancy, it's like you've had 8 different teachers to teach you instead of just one. So you're not just getting the homeroom teacher, you're getting a whole school full, so to speak.
Yeah.
And it's really, I think our patients really, really enjoy that interaction they get with our doctors and with our nurse midwives.
Yeah. Talk to me a little bit about, when you have a team of doctors, you're able to staff things at the hospital a little bit differently when it's time to have the baby. Talk to me about what some of the advantages are and how you guys do that hospital staffing different than other practices might.
Jen, unlike most OB/GYN practices or doctors in Florida, our doctors actually spend the night in the hospital and are physically there 24 hours a day. Christmas Day, I'm working Christmas Eve this year. Christmas, New Year's, whatever, someone's always there. And the reason we do that is, first you can't plan accidents and disasters. And sometimes, although we hope most pregnant ladies have a uneventful pregnancy and delivery, bad things sometimes happen. And if you're there, you can jump in and help. And the second is, we don't enjoy, I call it the swooping in phenomenon, where you come rushing in, do the delivery, and rush back out to the office or to home. When we're in the hospital, we're not doing surgery somewhere else. We're not seeing patients in the office. We're not at home. We're there for our patients and for the nurses.
And Dr. Hill, great advice. Thank you so much for the opportunity to learn a little bit more about what we should do if we're thinking about having a baby. If you want to connect with Dr. Hill, you can do so by calling 407-303-DOCS. You can get an appointment with them or visit their website. That's at lockhavenobgyn.com.